And thank you, the entire Hindi team. Now it is the time for the English session. Thank you, Sayani sir. Bye-bye. Now we are beginning our English session. Before beginning the session, we'll have a silent prayer. Good evening and welcome once again. Today is our 1876th day of continuous webinar. Thank you everyone for joining with us. Today's our guest is Dr. SADAT SAIT. He has already taken classes in our forum in the 3 languages. Malayalam also he took class, Hindi also he took. And he's having 27 years of experience and he's running SAIT Homeopathy Clinic in Alva and Cochin. And he's the leader of various associations and he's taking many classes and seminars. And I'm inviting Dr. SADAT SAIT to our forum. You are welcome, sir. Okay. Who is the host?
No, you are the host now.
Okay. Thank you.
I have
Thank you, sir.
the host to you.
Okay, I'll mute. Okay, sir, you are welcome. Please.
Yeah. Thank you so much. Are you hearing me?
Yes.
Okay. Thank you so much, Dr. Ajini, for inviting me to this platform. I thought I was a little late.
No, it's we are sharp.
Yeah,
Because
just 3 minutes.
already it is 2 minutes. We finished.
No, the issue is Dr. Srinath Rao is on the way. My teacher,
Okay.
Father Mullah. So he's on the way. I had to picking up a lot of mess. Okay, leave all that. Let me start my session with the last time we took about skin.
Yeah.
Okay. This time also I wanted to start with the skin. But before that,
You will become a homeopathic dermatologist, I think.
let me. That's what
Skin and
Dr.
hair.
Danesh told me. It's a skin again.
Yeah, skin and hair. You are concentrating on hair growth, skin. So everyone is taking some specialities, right? So you have many dermatological cases.
Yes.
Are you sharing the slide?
Yeah, I'm just sharing the slide. I'm just checking it out. Which once we start, we should start with the bang, no? That one second. Just a second. Let me share the English session.
Where are you today?
Today in my house only.
Ah.
Okay, not this slide. Oh, one second. I wanted to show that.
What happened? It's not.
No. It's not the matter of there. Okay, I think this one. Okay. Can you see me? Can you see the slides?
Yes.
Okay. This lady is called Dr. Stella. Not Dr. Stella. She's a patient, Stella. She has got a cardiac problem. She has got numerous complaints. I don't know. Wherever she goes, she falls or she gets into an accident. Even if she walks on the street, she gets into an accident. Some auto rickshaw or something will come and hit her. This time she went outside. She's a nun who is running a hostel. Okay. And she went she went into the compound of the hostel which she runs, and she was bitten by snake. Okay. This is a case of a snake bite, successfully treated with homeopathy. And this lady, it happened almost around 8:30, 9:30. So everyone picked her up to the hospital. Nothing was there. No antivenom was given because there was no antivenom in the hospital. Then she asked for a discharge by around 11:30 in the night. And she came to my clinic. 11:30, she wanted a discharge because she has been with my patient for last 10 years for almost every complaint. even the cardiac complaint. She came to me when she was posted for a cardiac surgery with a block. She said, I'm not doing it because someone in the hospital told that, why are you doing this? You can go and talk to the Dr. Sadat Sait. It's next to your, it is hardly 500 meters from her hostel to my clinic, but she has to be advised by someone else from the hospital. So just imagine how does we spread our names. She came to me with a cardiac complaint, no surgery since last 10 years. She's with homeopathic medicines, everything on and off. Now she comes. She's cardiac problem is not there. She is with homeopathy and surviving to the since last 10, maybe more than 10 years. This time she was bit with a snake, and 12 o'clock in the night, 11:30, I'm in the theater, I'm getting a call from her. She said, doctor, I am in the hospital. What are you going to do? I'm theater, you have to come out. I'm coming to the hospital in 10 minutes from discharging from the, getting discharged from the biggest hospital here. I want to, if I died, if I'm happy, more than happy to die in your clinic instead of spending it here. 4 hours, they just did this one, some medicines given, but not the antivenom was given. She came to the clinic, and this is the bite. Okay. And she is still alive with only a homeopathic medicine. I gave her, medicine given was Merxol, Silesia, Calendula tincture. This is not the Princey, this is not for, sorry. The medicine was given was Echinacea, Crotalus horridus, and Vipera 30. These are the 3 medicines given her. She is fit and fine, no issues. She survived. I gave it every 10 minutes to be taken. 11:30, she came to my clinic in the night. Next day, I thought, and the police came to the, and she went back to the hostel. And 12 o'clock, 12:30, 1 o'clock, police called up. The hospital people informed the police that she got the discharge with from discharge without their consent. So they went to the hostel. They said, I'm going for this doctor. I'm not going to get treated there. I have to give a medicine. I have to give the consent. I'm taking the responsibility. Anything happens, the hospital is not responsible. I will be the responsible for that. I give the consent, gave the medicine earlier only, but I gave the consent, and she is surviving. No medicines. It just took around 1 week medicine. She is no issues with her. Okay, the viper only bit her. Okay, so that is the one of my beautiful experience with a snake bite case. Okay, a lot of senior doctors have helped me in taking up this case, courage to take this case in a. I was also shocked to hear the what are called faith in homeopathy and me for the snake bite also. She is happily surviving. She is happily there. He is working. He is doing everything. I can even bring the live also if for the next meeting or something like that. Okay. This is another diabetic ulcer case. Name is Philip. Age 55. Okay. And you can see the process, healing process. Can you see me? See the slides? Okay, the picture will tell you the different situations, different this ones, how that has been healed. Okay. See the different stages of healing. Okay, this case was he is a diabetic, and the rusted nail went into his foot, got swollen. He was admitted in the hospital, but was discharged in a day or two. Nothing can be done. They said amputation. Again, came to me. Luckily, his daughter is a allopathic doctor, but she helped in dressing him with calendula and echinacea. Okay, no other medicines were being used. The medicine used was gunpowder 3x, silesia 1 arm, in different stages of healing, vipera, merxol, calendula, and echinacea dressing. These are the medicines given to him in different days, in different stages of. This is the stage when the granulation started. We gave calendula internally and echinacea. Silesia was also given. See, these are the pictures. The wound is so deep, we couldn't even see the depth. Okay. And now see this. Hopefully, it just took almost 3 weeks or month to heal the full ulcer. This is again a case of varicose ulcers. Her name is a Princey, aged around 39-40. Matthew. This is a case of a Princey, age 36, Ernakulam diabetic ulcer. Again, medicine given was merxol, silesia, calendula tincture, and gunpowder. This is, we have to see it to believe it. This is a different pictures of different stages. See, whole leg was ulcerated. Different stages. 1, 2, healed ones. You can see the healed legs also. Right hand side, there's a healed one. Healed ulcers. Okay. I'm not saying every case we could help her, but lot of cases in the sense, lot of cases. 1 second, just a second, I have to pick this call. Sir. Sir, where are you? Sorry, my sir was on the way. He is from Kottayam. Okay, this is this one. Okay. Again, the homeopathy, it's nothing wonderful. Only thing is we have to be careful with the dressings. We'll have to ask the patient to come for the dressings properly. This is a case of renal calculi. See, the patient has sent me with the closet that blood and the renal stone also. But this is the what are called ultrasound. Bilateral renal calculi, left distal uretary calculus, causing minimal hydronephrosis. Features of bilateral mild pyelitis and ureteritis. And this is the result. Do you want any more results? I think the picture speaks everything. Medicine is, everyone knows. Belladonna 10 I have given for this case. Okay, belladonna 10 because my teacher Dr. Tiwari has given one case with the belladonna 10 frequently. Every 1 hourly or 2 hourly has given it. One case when I was an intern. So took that, this one, gave this, then berberis vulgaris was given, hydrangea and sarsaparilla. These three medicines was given repeatedly, one after the other, maybe around 4 times morning in this. See, for me, the result matters. The result is in front of you. Okay, it is very easy, very predictable. Nothing more I can tell you. Nothing more I have to tell you. This is the result. Result is in front of you with the renal stones. This is another case of hair fall. Okay, different stages. See the hair fall, see the result. On to the right side, see the results. This is also different stages of growth. Okay, medicine. Again, here the medicines are medicine depends on the cause. If the cause is the dandruff, it's a set of different medicines. If the cause is any other fever or anything, hair loss, anything of that sort, depending on the cause, this is different. If the hereditary, we have to think about the myocytes. If there is a hereditary cause, think about the myocytes. And I use my external oil, which I prepare myself. Okay, this is the result. The medicines I gave in this particular case is syphilinum, as he has a history of what are called hereditary. So syphilitic myasm is one of the prominent myasm which has gone into the next generations. One. Plus I gave him selenium. Selenium because of the hairs are thinning. Okay, and it was cracking in this case. Okay. And selenium, thallium. Thallium because we don't have any cause. Thallium has a cause of exhausting fever or anything of that sort. If there is nothing, this speaks out. Thallium is one of the best medicine. If you don't get any reasons for the hair fall, give thallium. Thallium is one of the best medicine for hair fall. And if you can supplement or diet with the vitamin B12 and B complex group, if you can give the diet, or if you can supplement it, well and good. Or if you have this, you have to see for the vitamins or any hormone issue or any other complaints. If you have to replace that with the diet, you can replace it with the diet. But for the better results, we have to give him the faster results, because we are living in a competitive world. If I don't give results, he will go to the hair fixing. This took almost 1.5 months for this kind of a growth. See the right picture. Right? So we have to give the result at the earliest. Nothing, we cannot just keep on asking them, okay, wait, it will come down, wait, it will grow. Nothing of that sort. We have to give the results. This is a snake bite medicine given. That first case which I showed you, snake bite, reported 4 days back. That was recently, means it was in the 2023. Still the patient is alive. Taken to nearest hospital, discharged against the will. Reported to me in the middle night, gave medicines. Ledampal was given, Vipera was given, Echinacea and Lacasis. Crotalus horridus also given. Felt chest pain on the 4th day, night 10:30. Asked to take some medicine 1 hourly till she sleeps. Reported next day morning, means 5th morning. Okay. Medicine, hair growth medicine, syphilinum, thyroidinum plus hair oil, we can give it. It will give you best results. 1 month of internal 1 month of internal, not oil, it is internal medicine, and 2 months of oil. Okay, that I'm showing the case. This is the case. Unfortunately, I couldn't take the first picture. Okay. He wanted to just to grow the hair. It was a normal hair. 2 months of hair oil and 1 month of internal medicines. The result is this. Unfortunately, by my this one, I didn't get him. Even I also didn't expect this result. So I thought it will take time. We'll take the pictures later. Now this is the case. Okay. See the hair growth. He was a normal haircut, so I thought it will take months or 6 months for him to grow the hair. So I didn't take the pictures, and this is the result. That was a biggest mistake, biggest loss. I couldn't show this the previous cases. Okay. And this case, today is a variety of cases, huh? Not just the skin. This case is a case of toe walking. This case is our toe walking. The baby walks only on toes, and not on toes. That is on the finger. That toe walking is there. It is clearly written in the boric italics. Okay. Okay. This is after he started walking in the walking properly. Baby X, I couldn't mention that this one. This is a case of toe walking. Now I think if you check out this Vasudev, Dr. Sujana Robin, if you check it out, you will see the videos. Because it's a doctor's script, I didn't put everything together because this I don't wanted to give it publicly. But this is available. The babies walk, everything. Now he is almost 2 years or something more than that. Okay, you can get all the details there of this boy. Okay, this is the Facebook post he has did it. She did it after baby was started walking. Okay, it's in local language in Malayalam, Kerala language. So beautiful review. Okay, this is the picture. See the toe walking and the results you can see in the Facebook. Anything in the Facebook. So this is the pictures. This is the cases. Once more, I'm showing the pictures for any latecomers. Can you just mute it for a second, please? He doesn't know the house, so little confused. Sorry for that. Okay, I'm showing this pages. This one cases. Here again. Okay, the result for the latecomers. This is a renal stone case. Again with the picture. Now, evidence based, no one can tell you, okay, we have been cheating, we are homeopathy without evidence, nothing. I can bring the live patient also if you want, no issues. See, this is again varicose ulcer. This is diabetic ulcers. Healed ones. Okay. This is a snake bite case. Again, I think this is last time I showed this cases. That is why I'm skipping all this. This case also, I think last time I showed this. This is also diabetic ulcer. Amputation was recommended. Again the cases. Okay, healed. See the right side, it is healing. This is another case. This is also diabetic ulcer. See the stages. See the legs. Okay, I'm stopping this slide. I'm coming up with another slides. Why I'm trying this is I wanted to show one case which will blow everyone's head in 15-20 days. Last time Malayalam language I showed that. I'm just checking into the cosmetology where last time. I'm really sorry. No, I'm not getting that slide. Okay, fine, leave that. One next classes I'll show this. That 15, that is a fresh one. So I don't have to, this case. I think Kerala people must have seen it. Did this case was, did anyone see this cases? Okay, skin. Can you see this slide?
Yes, sir.
Okay. This picture says at all, everything. I don't have to explain. Only thing I'll tell you the medicines given, why it was given. That's it. This is self-explanatory. Nothing. Every stages has been in the pictures, and we are lucky enough. Patient admitted. Patient asked. Patient allowed us to take the case pictures. Okay. See the healed ones. Different stages. Different stages of healing. Different stages of healing. 1, 2, 3. How many pictures you want? 4, 5. How many? 8, 9, 10 slides of different stages. This is the last one healed. Not even a single scar. Okay. See the right hand picture. Not even a single scar. Patient name is Roma. She is still coming with to us with a lot of any complaint that family is with me. Osteoarthritis, allergic reaction to Ayurvedic treatment. The medicine used is calendula, echinacea dressing. In between, I have used curcuma also. Medicine used is calendula, echinacea dressing, gunpowder. 1 second. I think he has to be accommodated and he has to be taken. Because I'm here because of him. So we can't say no to anything. Sorry. Okay. This is the case. Roma, 59 years, osteoarthritis. The gunpowder 3x was given frequently. Otherwise, this wouldn't have healed it. Streptococcin also, staphylococcin was given because to prevent the septicemia. Epismel 30, staphylococcin was given. Calotropis 30 because of the, you have to see for that calotropis has the doctrine of signature. Whatever the calotropis, that white discharge, if it touches our skin, it gives a bullous appearance. So that was given here. That was taken care of this. Calotropis. Again, my seniors helped me with this. Calotropis. Okay, graphite is 30. Petroleum in the later stages when the things were drying up, no discharge was there. When slight discharge and the sticky discharge was there, graphite was given. When the discharge stopped and it started healing, no discharge came up. When the drying stages, petroleum was given. Echinacea tincture to prevent again the septicemia. Echinacea is one of the best medicines we can prevent it. You can prevent the septicemia. Sir, you can come here, sir. You can see my sir also. This is again varicose veins, ulcers. See the difference. See the changes. Again varicose ulcers. Again unhealed varicose ulcers. See it becomes too tough for us because we are dealing it in our OP, where infrastructure is very, 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 very minimal. That is why it has to be risky to take these cases. If there is a septicemia, it is very difficult to take the cases. But this is Trust in homeopathy, trust in my teachers, trust in my taking risk. See the cases. Name Mary Philomena, age 17, non-healing varicose ulcer of 7-year duration. And this is after skin graft also. Medicines used are again syphilinum for the punched out ulcers, Merxol, Vipera, and Calendula. I am feeling proud. This has been presented in front of my teacher. Okay, Echinacea pyrogen. This took little time because 7 years of duration. She had a varicose vein plus the circulation to the leg. Doppler study was done, and this case was having a feeble blood circulation, so it was more tougher. So this one was, and in front of her, it was in the monsoon season. She was getting wet. Her feet was getting wet in between because if she has to come to my clinic, she has to cross all the water loggings in front of the this one. This was the time when the flood situation was there. This case was taken when the flood was going on. So more the tough, but she had to come here because there's no other go. And picture says, I'm not, we don't have to blush or we don't have to tell a single word to anyone, any criticizers of homeopathy. Just show this picture and that's it, enough. Nowadays, we don't argue with the people who fight homeopathy or people doesn't have a faith in homeopathy. This is again cellulitis. See the situations. I don't have to explain anything, right? Picture says it all. The medicine again, Susan Simon, she is diabetic, cellulitis. Her condition was very, very, very worse. And luckily, this patient was in the hospital also. There's a medical trust hospital. They allowed us to treat. I'm very grateful to that hospital and the doctor who was treating. They allowed us to take the case. Medicine was given, acid force was given just to control the diabetes very quickly. Fluorescein. Fluorescein also is one of the best medicine for diabetic control. Fluorescein, if you give it today, tomorrow morning, you can get the result. Today night, if you give fluorescein 30 or 6 or whatever available potency, you give it every 10 minutes or 15 minutes of 3 or 4 or 5 doses. Next day morning, the sugar will come down. Merxol 30, again, Silesia, Epismal, this all that was done in a week's time. We didn't have any other choice to give the medicines frequently and repeatedly because it was in the hospital. The patient was in the ICU with the diabetic ketoacidosis and things like that. And the patient was, we could do this in the ICU also. So that was the patient husband asked that hospital people to let me do the medicines. He asked, do you people have anything to be done? Nothing. So why don't you other system do it at our risk? So that is something which cannot be forgotten. This is the cases which you saw earlier also. I'm not explaining it to you. Beautifully healed. This is a doctor's case, still there, alive and kicking. This is another case of, I think, psoriasis. It is a psoriasis case. See this? See the right side, it is started healing. Left hand side. The picture of left hand side, maybe it took almost 3 months. I'm not just, we give the medicine and it just started healing. No. 3 months it took for me to get into this shape of the left-handed side. Now it is clear, you will not even recognize the leg. Now what happened is after 1 or 2 years, he has developed CA. For that also, we are giving the medicines. His platelet count is coming down frequently. Allopathic medicines has been given. Chemo is there. Along with that, the hospital people, we are what is that? We are giving medicines along with the Aster Medicity, the biggest hospital of Kerala. So they have allowing me to give the medicine also. They have informed the son has informed the hospital also. They have said that why don't you give it? let's do whatever the possible. The platelet, that I'll show you in another slide. The platelet is improving. The medicines, you can get wonderful results for the improvement of platelets. You cannot get any other symptoms. If there is a platelet coming down from 1,50,000, anything to 20-25,000, X-ray 30, Protalus horridus, phosphorus. These three medicines, if you have it in your pocket, in your clinic, dengue is just like 3 days, 1 day, 2 day, 3 day. Blind prescription also you can give it, save the patient. This is the confidence I'm telling you. COVID we treated with these medicines. Dengue epidemic, this saved homeopathy and me. I don't know how many cases. Platelet count coming down to maybe around, I've treated even 15,000 when the platelet was there. Luckily, bleeding was started and I started 15,000. These medicines took care of it. Okay. So, only thing is that we need to take risk at times. The risk is it will make you or it will break you. As a homeopathic doctor, it will break you, it will make you. Nothing else I can tell you is, okay. So this is another slides with my experiences of treating skin diseases. Not skin disease. Skin diseases, it's okay with me. Only except the psoriasis cases, it takes little time. Rest skin cases, if this is the situation, anything is possible with homeopathy. I'm not saying that I can only treat it. Anyone can treat it. We have medicines. We can do a lot of things. We can share it. We can do it. This is the confidence I can share it with you. So go ahead, take any cases. Anything is possible with homeopathy. Homeopathy has to be given proper timing, repetitions. If you ask me proper organon and aphorisms, sorry, I will not be able to give you the aphorism, but I can give you why this medicine was selected, why not the other one, why did you select this, the criteria of selecting the medicines. I can give you any time. Okay. I can vouch on this. Again, I'm stopping this. Coming up with another one. Slides are plenty. This is something called, it comes to our clinic very, very, very often. And this is one of the right thing. This is one of the best thing homeopathy can invade. Cosmetic homeopathy, cosmetology and homeopathy. Okay. Can you see this slide? Dr. Ajini?
Yes.
Okay.
Cosmetic.
Everyone is getting these problems. Pimples, I don't have to explain. This is one of the best field homeopathy can do anything. Cosmetology, homeopathy, we all treat pimples. But the problem with our homeopathy is we don't market. We don't tell that, okay, cosmetology division, we have it. We treat everything. We treat hair fall, we treat pigmentation, we treat pimples, we treat acne, we treat everything. But we won't say that, okay, we are treating cosmetic problems. We should know how to market our products. We have everything in our hand. We should know how to put it into the people, what we should do. We telling the people. I'm not going through the theory part of it. I'm just going through the homeopathic part of it. Okay. Sulfur, I'm giving all the common names here. Sulfur, pulsatilla, natramur. Natramur medicines, everyone know. Sulfur iodide is something which we have to think about it. Sulfur, the pimples are red. Plus iodine, it is hard. Belladonna, pimples are red, but it is a softer one. It's not too hard like iodine. So when the sulfur and iodine comes in, it is a biggest and thick ones. But whenever you treat any pimple cases with the crops, you have to rule out if there is a dandruff, or you have a PCOD. So rule out both the conditions. If you don't have it, think about it. If you get the cause, treat the cause. Constitution medicines, I'm not saying that constitution medicines are good. Your constitution medicine has to be given. Miasmatic medicine has to be given. If we have all the details of the case taking has to be taken. But beyond that, we have thousands of medicines. Constitution medicine or this ones. The commonly used medicines, constitution medicine, everything has its own place. It has to be given. I'm totally for it. I'm there to give single medicines. If you can give all these medicines can be given in single medicines, but you have to see the PQRS. Why the presenting symptoms also has to be taken into consideration. That is why Hahnemann has told physical appearance of the patient, physical appearance of the disease. We have to examine the cases. That becomes more important. Silesia again, sulfur iodide is a common. Carboanimalis, I will explain it to you. Carboanimalis mostly with the allergy of the blade or allergy of things. Any allergic with the nails, blades, carboanimalis comes up with the first thought process. Hydrocotyl, again to clean up. Hydrocotyl can be used to clean. Instead of the cleanser is available on the market, we have the better cleaner. And once we clean, first you wash it with a lukewarm water. Every pimple or every skin cleansing should start with lukewarm water, not the hot water or not the cold water. Lukewarm water cleanses our face in a better way. Lukewarm water balances the oils in the face. It cleans up, it opens the pores. Then use hydrocotyl. We have lot of medicines to use as a cleanser. Instead of using the market products in the face, this one cleanser can be used in a better way. Sarsaparilla, we say that cleaning up. Sarsaparilla is a herb. We can use a cleaning up internally, the blood purifier. Sarsaparilla is also again called the blood purifier. Thiocinaminum, when the marks are more, to reduce the acne scars. Thiocinaminum, there's no other medicine better than thiocinaminum. Anti-crude, again hard. And the food habits, if the patient has a preference to the pickles, apples, pickles. And if you take the constitution, again, if the patient is restless, no other medicine, anti-crude, calcarea sulf, again, calcarea and sulfur. So calcarea sulfase, you see this patient, calcarea and sulfur, if it comes, you can think about PCOD, rule out PCOD if the constitution or medicines, if you are thinking about giving sulfur, calcarea sulf as a constitution or acute or whatever it is, think about PCOD, because 90% of the cases, my experience showed the patient must be having a trait of PCOD or PCOS. Okay, radium bromide, radium bromatum, even in the cases of chemotherapy, radiations, when the breakout of pimples after radiations, during chemotherapy, hair fall after radiations, radium bromatum, beautiful results. You try this out. Bovista, if the hair fall or if the pimples are after cosmetics, if in no other cause, the cause is after cosmetics. Bovista, blind, close your eyes. I can tell you any number of statistics. Calibromatum, you know that. Berberis acifolium, I don't have to explain why Berberis acifolium has to be given. Juglans regia is one of the best medicine for axillary abscess also. So any kind of abscess, any kind of pustular eruptions, it gives scar also. So Juglans regia is one of the best medicine, almost specific for axillary abscess. You give it every 2 hourly, in 2 or 3 days, it will burst. Okay, that we say, that tip will start, it will burst. You have to just squeeze it, it will come. Eugenia jambosa, the hardest, you can say it's the hardest one. That is one thing which, and it has a lot of Eugenia Jamposa is one of the best medicine for polycystic ovary also. The polycystic ovary, hard gland, hard, this one, sebaceous cyst is hard. And it is one of the best medicine for even for chalazion. Okay. So face lotions, I use face lotions, we give it after cleansing, Olean jacoris, Berberis acifolium, tincture glycerin, but tincture glycerin, before you use it, you cannot use it frequently. Use very, very, very little quantity, 5 drops or 10 drops in this one, because glycerin has a habit of absorbing the moisture. It is can be used even for iodine. It can be used even for the cleaning up or drying up the wound. Hydrocortisone, Jaberandi, salicylic acid and lactic acid. Why? Serums, the 100% the market serums in the market is lactic acid and salicylic acid products. And there is one is hyaluronic acid. Then another is what is that? What we give it for the kids for the renal problem and fever. And it is a banned product now. When it is banned for the kids, they started using it in the face. I don't know what is. I forgot the name. It's one of the dangerous medicine. It can have an effect on the kidney also. Can anyone tell me that it is banned in India? Huh? No, this one, allopathic medicines. Salicylic acid, we can use it. What I'm doing it is bring the crude salicylic acid, use rectified spirit, or you can dilute it with water or rose water and apply it instead of the buying it from the serums from the market. It's very simple. We can use it. Salicylic acid is our medicine. Lactic acid is our medicine. Both are very good in pain reduction, fibromyalgia. Salicylic acid and lactic acid. Lactic acid is one of the best medicine. I've given it in this one, viral fevers, for the body pains, hepatorium. Instead of hepatorium and other complaints, lactic acid and salicylic acid is one of the best medicines. Salicylic acid is a product. It's a content of Gualtheria. So Gualtheria tinctures, if you are using for pain, salicylic acid is an extract from that gives much better results. It's a practical result I'm talking about. Salicylic acid is one of the best medicine to reduce fibromyalgia pains, So this also can be used in treating pimples as a cleanser or a serum or whatever you wanted to tell me, anything. Okay. Don't tell me that external. Hahnemann has told me in the last session, so last aphorism, organon 6. Mesmerism also has come. If you would have been there for now, his thought process might have changed, I don't know. But we are living again, cosmetology, we are living again in a market where we have to compete with, at least I have to compete with 10, 15, 20, 30 cosmetic hospitals, cosmetic surgeons, cosmetic people in 2-3 kilometers radius. So I don't know what to tell you. Again, sulfur. Hopefully I don't have to go and detail about the medicines. Everyone knows that. And face scrubs. Face scrubs, if you wanted to use natural face scrubs, honey, sugar, oleum centale, oleum jacoris, and hydrocortisone if you wanted to add. Otherwise, oleum centale, if you can get it. And sugar has to be not fine coarse, this one, it has to be little rough. Normal sugar, little rough, mix it with the honey and our medicine oleum centale, and see the face in 1 or 2 days, at least a week, with our medicine internally. Okay, instead of face scrubs and glow skins and glow products, use this. Oleum centale gives one of the beautiful. Oleum centale is one of the another medicine for cough in the night coughs. When we give hyoscyamus, drosera, etc., etc., Oleum centale and Viburnum prunifolium is one of the best medicines. I don't know how many have used it. Oleum centale is one of the best medicine for night coughs. Okay. So medicines explanations, everything is given. I'm going little. Do we have time?
No,
Ajini,
sir.
doctor?
No, we have only 4 minutes.
4 minutes. So I'll stop it here.
Yes.
Is that okay? Anyone have
Yes,
any
yes.
doubts? You can ask me. Or next time we can start other things in the cosmetology and skin.
Sir, I have noticed that you have given gunpowder 3x in 2-3 cases.
Yes,
Can you
ma'am.
tell me the indications?
Gunpowder is indicated in when I gave was septicemia.
Mhm.
Gunpowder heals the wound as early as any antibiotics.
Okay.
You can say even faster than antibiotics.
Oh. And 3x is the potency that you are choosing.
3x, if it is available, yes. Otherwise, 33x. Okay. Not less than 3x, because one gunpowder becomes little poisonous, or it can give you adverse effect if it's in 1x, 2x. 3x is the safest, can be repeated depending on the cases.
Okay, sir, I think there is no other questions. Anyone is having questions, please raise your hands. We have only 3 minutes left to ask question even. I think there is no question. Medical suggestion for pigmentation on face. It's a question in the chat box.
It is coming next time. It is after this pimples.
Pigmentation of face. They're not talking about the
Melasma and pigmentations, everything. Next class, I can explain it in detail and details.
Dr. Anita, I think you got
You can ask me personally, I can tell you. Otherwise, whole class is there on that one. Cosmetics.
She said
Is that
okay.
okay? Because it will not be over in a minute.
Yeah. She's just asking, I think.
Please, ma'am, you can ask me personally. I can give you any number of cases and any number
Dr.
of
Anita,
medicine.
you can send message directly to Dr. SADAT SAIT. I think your number is written in the link, right?
Yeah. You can search me Facebook, Insta, LinkedIn.
Okay.
We are everywhere. We are around the world.
Okay, thank you so much, sir. On behalf of IFPH and come again. Thank you so much. In your busy schedule, you spend time with us. And good night, everyone. Bye-bye. Now we are moving to the Malayalam session. Thank you, sir, again. I'm inviting Dr. Shaila for moderating Malayalam session. Please.